Hi all. It is another video session regarding OET letter writing. Today we are going to discuss a case note thoroughly and we are going to write a letter. The case note is about Chris Justin, a 14-year-old student who studies in grade 10. Now, he is affected with pulmonary tuberculosis. At present, he is at the hospital. On request, he's been discharged on 16/7/2019. And we are writing letter to school health nurse to make his arrangements at school for the exam. So watch closely. Let's do the case note discussion and to write a letter. At the end of the video, there is a sample letter too. So let's see.
The treatment which is administered is as you see in the case note, and he has undergone some examinations, blood test, and increased white blood count cells have been seen, increased ESR is noted, and his AFB test is positive as you see in the case note. Sputum test is done and AFB test is done. Chest X-ray has done and it shows the cavity in the upper part of the right lung. And he feels kind of isolation, and he was started with anti-tuberculosis drugs, and he was given high protein diet. Now you see here his vitals are unremarkable, positive AFP sputum, we already discussed that. And the thing is, Chris is so anxious about his exam which is scheduled to happen on 17th. That's the reason his parents requested for discharge. On demand of parents' request, he is being discharged today for the exam. The things we need to arrange as the writing task talks here. You're writing letter to school health nurse. So the things which I explained here is the thing that is in the writing case note, the case note. And the writing task tells us to write a letter to school nurse who is going to take care of during his exam. And the writing purpose is to provide necessary care and arrangement for Chris examination. Now, that's what the case note is. Our patient is Chris Justin. He is studying in grade 10. He was affected with tuberculosis. We know that it's a contagious disease, so we have to take precautionary methods. It should not be spread to others. And he's going to school to write exam, and the school health nurse is so responsible for his precautionary methods or measures, and the care which is to be given for him. And he is so anxious also, so the school health nurse has to relieve allay his anxiety, and separate classroom supposed to be arranged, that is being said in discharge plan. Arrange separate classroom and precautionary methods has to be taken, and there's a medicine to be administered at 11 o'clock. So these are the things which you should mention in your letter. Keeping all these in your mind, how can we go for a possible answer for the letter writing? So let's see here. The introductory part is written, the date we have written like 16 July 2019, and we are addressing to Miss Jaimy Adam, school nurse in cities Queensland, Waterville, Australia. And we written the referral as Chris Justin, and we go for the introductory part of the letter. We know that our client, our patient is Chris Justin, who is just a 14-year-old student. Now we focus on our writing purpose. Chris Justin, who has pulmonary tuberculosis. We say that he has pulmonary tuberculosis, which is not cured actually. He has taken a break in between for the exam. So Chris Justin, who has pulmonary tuberculosis, what is his requirement? He requires necessary care and arrangement for the examination, and now he is discharged. So the introduction can be like this: Chris Justin, who has pulmonary tuberculosis, requires necessary care and arrangement for his examination from your service. He is being discharged today. Now we go for his history, in the sense the present problem that he has and how it was diagnosed. For that, from the case note, we collect the data and we organize it well in a manner as it is shown in the slide. Chris Justin had complaints of persistent cough, fever, and weight loss. He underwent various diagnostic tests which confirmed the diagnosis. Hence, Chris Justin was isolated and was commenced on anti-tuberculosis, antipyretic, and antibiotic drugs. So this paragraph clearly gives an idea that what are the symptoms he had and how the symptoms were diagnosed, and he had undergone various required diagnostic test by which it was diagnosed as pulmonary tuberculosis. So he was started with some kind of medicines like anti-tuberculosis medicine, antibiotics. So those important data we gathered together and made one paragraph, and we moved to another paragraph about his anxious and everything. So that paragraph can be like this: Chris Justin is anxious about his examination, which is scheduled for 17th July 2019. Thus, his parents have requested for the discharge. However, his AFB is still positive. Thus, one-day permission is granted with a complete standard precaution, which is to be followed at school. So, the parents requested, since their son Chris Justin is anxious about the exam which is scheduled, and the thing is, though he is anxious, his AFB is still positive, and there can be a chance to spread. Only for the exam, doctor granted one-day permission. So under the supervision of school nurse, so standard precaution have to be taken at school. So only those particular data is mentioned in this paragraph, and as we move forward, all these reasons are there. So by this reason, what we have to be done? So in this regard, you are requested to arrange a separate classroom and necessary precautionary measures for him for the exam. In addition, kindly administer tab isoniazid at 11 a.m. So that is actually, we explain the writing purpose in detail. In the introduction, we have seen requires necessary care and arrangement. So what are the arrangements have to be taken for the exam? Let the school nurse have to take it and get him treated or get him his medicine on correct time. What she has to do again is kindly allay his anxiety and support him as he is anxious and socially isolated. So Chris Justin feels kind of an isolation. So let the nurse make him comfort and console, making okay for his exam by some techniques or as she can do. And we are just telling additional one point to school nurse health nurse. Soon after the exam, Chris Justin has to go back to hospital because it's only 1 day permission. So one another detail is mentioned there, that please note transportation has been arranged back to the hospital. Do not hesitate to contact me for further queries. With that, we conclude the letter and we go for the signature part, last part. Yours sincerely, charge nurse, Waterville Hospital, Australia. So this is what the letter gives. How can be a possible? I don't say this is the best letter. This can be a possible letter that can be written for the case note Chris Justin. Chris Justin has pulmonary tuberculosis. He has to go for exam because he is so concerned about the exam. On request of parents, 1 day leave is granted by the doctor. That 1 day can be fruitfully utilized. So under the supervision of school health nurse. That's why we write letter to school health nurse. And these are the details that can be gathered for Chris Justin's necessary care and arrangement. Hope you could understand this one. Go through the case note carefully and go through the possible answer, the referral letter. Thank you for watching.